back on Unlock NCLEX. I am Utsavi Patel. I am back with one more informative video about NCLEX. You will find many more important information in this video because we are discussing and what is NCLEX. So stay tuned till the end. Before starting the video, click the bell icon. Don't forget to subscribe because I don't want that anyone from you miss any important information, so stay tuned. So today's video is on overview information about NCLEX. We are covering basic information on NCLEX, their eligibility, exam content, topic distribution, the CAT system, and their result evaluation, and many more. So don't miss it, guys. So as we know, the NCLEX is the license exam which gives you eligibility to work in USA, Canada, and Australia as a RN, as a RPN, or as a LPN. So I am describing 3 countries over here for the NCLEX. So yes, guys, as you have to know about this, okay? So NCLEX exam is same in these 3 countries. Only difference is their registration process, but the exam's rules, topic, content, everything remains same. And these 3 terms are an RPN and LPN. So let me clear this for you. So in Canada, there is a 3 regulated nursing profession area where nurse can work. It is RPN, which is registered psychiatric nurse, LPN, which is licensed practical nurse, and RN, which is registered nurse. So let's learn in more details. So in Canada, the difference between this nursing profession are in the type of education, their training, and the scope of practice. So the scope of practice refers to the type of work person is authorized to do based on their training and competences. According to the rules of regulatory bodies, the scope of practice for the nursing profession is varies by the province. So for the RPN, this is a regulated profession in British Columbia, Alberta, Saskatchewan, and Manitoba. So RPN usually requires a 2.5 to 4 years of nursing education at the college or university level. RPN programs include theoretical and clinical training in psychiatric and general nursing. RPN provides care for a patient with a complex psychosocial, mental health, and physical needs. They coordinate care for individuals, families, groups, communities, and varieties of healthcare settings and with a varieties of healthcare professionals. For the LPN, it requires a 2 to 3 years of college program leading to a nursing diploma. So training includes theory and clinical instructions in medical and surgical nursing. Nurse work with all types of patients and in a variety of clinical settings. So some LPNs are specialized in a particular type of nursing, although the scope of practice is more limited than that of an RN. So they will provide coordinate care for the all kind of individuals with the varieties of healthcare settings. They can work with the patients of varying complexity, consulting, collaborating with other healthcare professionals too. And for the RN, they require a 4 years of university program that leads to a nursing degree. An RN is a generalist nurse with the skills to work with all types of patients and all types of clinical settings. But the major role for the RN is the clinical instructions prepare the RN to take a leadership role when care requirements become more complex. Okay, so now you know about these 3 terms, but now you know about who must apply to the NCLEX. So if you are an internationally educated nurse who has completed your nursing education outside of Canada and you are seeking a registration to practice as a RN, LPN, or RPN in a Canadian province or any other country. So you must first complete the NNES process. So what is this NNES process? I haven't heard this. So this is basically a assessment process which will assist your all nursing experiences, employment, your registrations, your graduation, and everything about you. And then after, at the end, they will give you eligibility to go with your further process. So this is basically a first step to gain your license in Canada, Australia, or USA. So this is basically same in in this all three countries. But nowadays there are so much changes going on. So you have to update yourself as per your requirement or where you are applying, because nowadays many provinces in Canada are not required and same in USA and Australia too. So you must start with this process before or after your immigrations to Canada, US, and Australia as per your convenience. See? So NCLEX examination contains a bunch of subjects which you faced in your NCLEX examinations. Basically, the NCLEX question is comes out from these subjects which you known in your graduation time. So the topics, interventions, plans, and everything remain same, but you have to update yourselves for the critical thinkings, for your priority assessments and everything which is required in NCLEX. So NCLEX examination consists of professional standard in nursing, foundation of care, growth and development, maternity nursing, pediatric nursing, medical surgical disorders, and psychiatric nursing. So these are the basic topics which we learn in details in NCLEX. What is content distribution? So this serves as a roadmap outlining the content and the format of the exam. So the test plan consists of several key components. One of the primary ones is the client's needs category. So the NCLEX test plan also specifies the percentage of questions allocated to each category, giving you an idea of the importance placed on different aspects of nursing practice. So basically, they divide each category in a percentage as per NCLEX test plan. So among that, the first category we faced a management of care, which is consists of 14% in your NCLEX test plan. So these questions focus on the nurse's ability to provide and direct the nursing care to protect the clients and healthcare personnel, including tasks like delegating, supervising, coordinating care, as well as the managing resources and advocating the clients. The next is safety and infection control, which is consists of 13% of NCLEX test plan. And of course, as the name suggests, they will ask you questions regarding the environmental hazards, the infection prevention, emergency planning, and the maintaining client safety. The next one is health promotion and maintenance, which is consists of 9% of NCLEX test plan. And they will ask you from this category about the principle of growth and development, health educations to prevent health problems and promote optimal health. Psychosocial integrity, which is consists of 9% of your test plan. So from this topic, they will ask you about to provide the care, the support of the emotional, mental, social well-being of the client, experiencing the stressful events, including assessment of abuse, providing end-of-life care, using a therapeutic communication, etc. Basic care and comfort consists of 9% of your test plan. So these questions focus on providing comfort and assistance with the activity of daily living, including the managing elimination, promoting mobility, and providing a non-pharmacological comfort measures. Then the pharmac and parenteral therapy. So as the name suggests, question assess the nurse ability to administer medication and parenteral therapy safely and effectively. They include the calculation dosage, educating the clients about the medication, and monitoring the response to treatment. Risk reduction, they will consist 12% of your test plan, and they reduce the likelihood of complications of health problems by monitoring for changes, performing the diagnostic tests, and providing education on treatment and procedures. And the last is physiological adaptation, that will consist of 14% of your test plan. The questions focus on managing and providing care for clients with acute, chronic, or life-threatening physical health conditions, including tasks such as performing invasive procedures, managing ventilators, providing wound care. So this is the content distribution, the NCLEX test plan that you will face in your NCLEX examination. Next is CAT system. So what is this CAT system? So in NCLEX are administered to candidates by a computerized adaptive testing that we call a CAT system. So basically the whole NCLEX exam is computer based. So with the CAT system, each candidate's examination is unique because it is assembled interactively as the examination proceeds. Computer technology selects items that match the candidate's ability. With this system, the computer done evaluation your ability as per that they proceed with your exam. The candidate answer an item, the candidate computer calculate an ability estimate based on all of the candidate's previous answers. For example, you give one question answer and jump towards your next question. You're done with your process. But meanwhile, what the computer will gonna do, they're deciding your performance, they're reviewing your performance in a previous question. Is it correct? Is it wrong? If that question is right, if yes, then computer will give you your next question is little bit more harder than the previous one to test your ability. But if the answer is wrong, then you faced a little bit easy question which is again decided by your CAT method. So this will gonna continue till computer not test your ability or your result. So the next item is administer. It's chosen based on that ability estimate and it is selected from an appropriate test plan category. This process is repeated for each item. The examination continues with the item selected and administered in this way until a pass or fail decision is made. So as we know, this process will gonna continue till the computer haven't made this decision. So the length of examination is determined by the candidate's response to the item, but the length of candidate examination is not an indication of a pass or failed result, because sometimes what happens, the candidates do that they made their assumption as per the examination length, the questions numbers they attempt during the examination, but this is not true. You cannot assume your result on this silly assumptions. So don't do that, okay? Then reading NCLEX result. So Pearson VUE NCLEX result are reported only on a pass or fail basis. A past NCLEX official result gives you the green light to practice nursing. If you pass, no further details are given. But, however, those who are fail, the NCLEX are provided the CPR form, which details their score status in each individual's contained area. So this is basically that content distribution that will provide you a sheet in which they describe every content distribution as per NCLEX and your performance in each content. Who pass their exams, they will not have this sheet, okay? Performance in this contained area is only given as above the passing standard, near the passing standard, and below the passing standards. So what does that mean? So NCLEX result basically give you in a three in a statement form. In each contain they are give you three statements where you according to your performance. So what this means, we discuss. Okay, above passing standards, it is the candidate skill level is high. The question provided by the computer will be a complex, and the computer will evaluate that the person's skill level is above the passing standards. So whichever the area you have this statement, that means you are doing well. In that topic, you just need to continue with that because you are good in that contained area. So don't confuse, don't stress yourself, just continue with that flow. In whatever the contained, you have this statement. Okay, below the passing standard, in this skill level the candidate is low. The computer provide question will tend to be basic. Computer will evaluate the test taker skill level is below the passing standard. So that means in those content you have to think more critically. Update your strategies because your method is not that much goals. Update. Try hard, guys. And the last is near passing standard. So near passing standard means a particular candidate's ability estimate is not clearly above or not clearly below the passing standards in a contained area. That means you are not that bad. You are doing well, but practice more and more questions. Think smart. Don't get confused. You are doing well in that contained area. Now you are saying that you are listing all of the things, but I'm not getting what kind of sheet I have if I have failed. Okay, so this is how you have this kind of sheet which is evaluating your content and your performance level. Okay, so this is the sheet which you have when you are failed. In the left side the all contained area, and in the right side your performance level. So as per that you can upgrade your strategies, work hard on that area where you are lacking, and in this way you can get your license in the next attempt for sure guys. Remember guys, most great people have attained that greatest success just one step beyond that greatest failure. So never stop, work hard for your dreams. Okay then, I hope you like this video. Don't forget to subscribe. See you in next video. Bye bye guys.